Pasok mo yung kamat, sir.
Nanababo Kabalen, kumusta kayo po? My name is Louie.
My name is Marco Nanan of We're in Pampanga, where we discover great places for you to check out.
For today's vlog, nandito tayo ngayon sa Unicare Diagnostics. Located po ito dito sa may San Fernando, Pampanga. And the time is around 7 AM, brother.
Yes.
Ano ba yung mission natin today?
Actually, since nakita naman natin, puro kain tayo, time naman natin for our health naman.
Correct. So for today's vlog, meron po tayong complete blood chem, may consultation sa doctor. It's time for us to have a self-care. Magpapacheck up po tayo ngayon.
Yes, as requested ng mga viewers natin. So tara, let's go!
Hello. Morning po. Good morning.
Good morning po.
Sir, good morning.
Good morning, sir.
Hello po, Ma'am Grace.
Hello po.
Louie.
Marco.
Ay, hello.
My
Welcome
father
to
po.
Unicare.
Yes po. Good morning.
So, ready, nakapag-fasting naman po kayo?
Nag-fasting naman po kami, ma'am.
Already naman
Okay.
po.
Dating natin dito, we're gonna go to the reception, register, sabi nga ni Madam. And then...
Kailangan din naman natin malaman
Yes.
kung ano yung mga conditions natin.
Exactly. Yeah, I think one of the issues sa mga nagpapa-check up is, say for example, alam nila na may nararamdaman nila, pero takot silang malaman kung ano yun or to confirm actually,
Yes,
di ba?
actually. So, to confirm kung ano nga man nararamdaman natin, so let's try na magpa-check up na rin.
Alright.
So, 21 po sila. So, may waiting pa kami na other HMO na accreditation. Coco Life, East West.
East West po bago dito. So these are the list of your services po?
Yes po, ito po yung mga price list namin.
Mhm.
Ito yung mga sa laboratory, ito yung sa
Xray.
Xray, Ultrasound, and other tests po.
So, blood extraction done. Next naman is ang Xray. Ayun nga, so since first time tayong mag-feature ng mga ganitong establishments, siyempre meron tayong mga personal doubts and questions, yung mga ganyan, di ba? So, Doc, sa mga nagpapa-blood chem o mga regular, mga clinical exams or diagnostics, usually, sir, tuwing kailan ba dapat nangyayari yun?
It depends on the patient, no, Sir Louie. Medyo marami siyang abnormal na findings, no? Let's say mataas yung sugar, mataas yung creatinine, and other exams like SGPT, SGOT for the liver, no? We usually advise for follow-ups sooner than those patients na normal in blood chem, no? Number one, we check for compliance, no? Number two, of course, we check his or her condition after prescribing the necessary medications. No? So, hindi naman talaga natin masasabi na wala na may particular tayong date, no? Kung kailan natin sila papabalikin. So, for routine check-ups naman, no? Let's say you had your laboratory today and then turned out normal naman lahat, no? Kung tatanungin mo ako kung gaano kadalas, no? Or kung gaano kailan ko siya papabalikan for follow-up. And for repeat laboratories, no? Actually, we can do it once or twice a year siguro. Would be okay.
So, again sir, thank you so much po for the enlightenment.
Okay.
Now, for us po, yung mga normal patient din po or mga gustong magpa-exam, what are your parang key takeaways or mga final advices?
Okay, sige. So, for those patients, no, na they just want to be checked, no, kahit wala silang nararamdaman, let's say, before undergoing laboratory tests or other diagnostic exams like Xray, ECG, they first need to seek medical advice. Number one, the doctor knows kung anong kailangan ipatest, no? They can save money, effort, no? Hindi na gagawin yung mga hindi kailangan ng exam. Laboratory tests and other diagnostic tests are just there to guide us.
Guide, okay.
No? So, important pa rin na makita namin yung patient sa clinic. No? We correlate the results with the condition of the patient. And then, we give advice.
There you go. There you go. Right, so that was it.
Yes.
We have our certificate of completion, sabi nga nila.
Actually, din yung mga results natin.
Actually, these are the results.
Yes.
So far, bro, how was the experience?
So, ako naman dito sa Unicare, napaka-gentle naman, same time, napaka-convenient.
Yun nga, napaka-accommodating ng mga tao dito.
At the same time din, na-enlighten tayo. Siyempre, doon sa mga bagay na ano mga dapat natin gawin, ano yung mga dapat iwasan, karoon na rin tayo ng self-check.
Correct.
Personally, have time to check yourself. Kahit wala kayong nararamdaman.
Correct.
Possible inside nyo, may mga abnormalities tayo. At the same time, syempre, seek for an expert.
Exactly. This is our personal surveillance then on our health. Guys, if you have any questions, inquiries regarding their services, and even mga prices do sa mga services na yun, make sure to check out po yung fan page we're gonna be including.
So, Unicare is located dito sa may Dolores, City of San Fernando. Ang pinaka-landmark lang po is tapat lang siya ng Good Shepherd.
Good Shepherd, yes.
Yes. And they are open from 6 a.m. until 5 p.m. Monday to Saturday.
There you have it, guys. Thanks so much for watching. We're in Pampanga. Until our next discovery.
Peace out.
Bye, guys.